All right, good morning, everybody. My name is Gideon Orbach. I'm one of Dr. Weiner's associates. Some of you I recognize. It's nice to see old friends coming back. Some of you are new for me. Welcome, new friends. And my father is a retired college professor. So he stood up in front of groups teaching classes for a living for 40 years. My brother makes presentations for a living now too, and they're both very good at it. So when you hang out at the Orbach household, they have an argument back and forth as to what's the best way to make a presentation, how do you address the crowd, and they say start with a joke or start by telling something personal about yourself to make yourself kind of more endeared to the crowd. So that's exactly what I'm going to do. I'm going to tell you something personal about me. I'm colorblind. I have a real hard time matching my tie and my shirt, so I have everything labeled. And I get away from that issue by almost always wearing a blue shirt. But the last time that we had a sale and I made a presentation, I was up against this wall, which is all white. And I couldn't wear my lab coat, consequently. And the video came out a little bit odd with my shirt color and the background and the tie, and I didn't like the way it looked. So I solved that problem. And with careful consultation, my mom helped me pick out a pink shirt out of my wardrobe. Now, going back a number of years ago, here's where the funny personal joke kind of stuff comes into play. Going back a number of years ago, my brother bought me a birthday gift, which was just this hot pink shirt. And apparently, my parents were in on the gag, and they kept complimenting me about how well it fit and how it was my color and it looked so good. And I'm feeling pretty good about myself. So away I went out on the town wearing my hot pink shirt, and I hope they at least had the decency to look at each other and give themselves that, should we tell them? Look, well, they didn't. So anyhow, I'm a little bit away from hot pink, but I think this is going to look better on the video this time around. And we have a new camera crew who told me I could wear my lab coat, and that's what all this conversation was about before the speech. So now that I feel endeared to you all, we can get on with the material. So what are we all here for? We want to be healthier, right? Came to Health and Wellness Week, right? Open house, party sale. We all want to learn magical tips to become healthier. Am I correct?
Yes.
We all want to get better advice on what we can do about that achy shoulder, or which supplements we should be taking, or maybe even a meal plan, right? We're in the right place? All right? What does it mean to be healthy? We're all here to be healthier. Do any of us know what health means? I heard somebody say to feel good. I like it. I'm sorry, I saw your hand go up. What did you? Pray tell.
Free of disease.
Free of disease. Not bad at all. Anybody else? Definition of health. Free of pain.
Is Adoria out there? Adoria?
We're looking for Adoria Peterson, who I believe took off. You found her? No, she didn't take off. Good. I'm sorry.
Happy.
Happy. I like it a lot. Anyone else?
Energy.
Energy. I think to possess the quality of good health, one must have the ability to recognize, interact with, adapt to, and overcome their environments, both internally and externally. The ability to recognize your environment, to interact with it, to adapt to it, and to overcome, inside and outside. All right, here's what I'm getting at. Let's say we all go to Kennywood. You guys know why it's so difficult to get an appointment here? We take frequent trips to Kennywood. We just close the practice, we head off to Kennywood, we ride the roller coasters, and unfortunately for Lynn and Sonia and Rita, they don't come, but they sit here and answer the phones and say, we can't schedule you for the next 3 months. Why? Because we're at Kennywood riding the roller coasters. So we all get shaken up, and although we might be eating our delicious vegan cuisine and we might be drinking our Pro Reds, lean greens, that's what's known as a shameless plug, folks. We're drinking those things. We're getting shaken up on the roller coasters. Some of us have an exercise in regurgitation. You guys know what that means?
Yeah.
It means those delicious vegan foods are going to exit the same hole they entered. Not a pretty sight, not at all. Some of us are going to be fine. Some of us are not going to have that exercise and regurgitation. Who do you guys think is healthier? Is that really a sign of being sick to expel your food? Maybe not. Maybe not. Maybe that's your body getting rid of stuff that it really shouldn't be handling right now. Maybe there's some toxicity involved. It wasn't delicious vegan food, and it was hot dogs and nacho chips with extra grease. We don't want to hold on to that stuff. We don't want it to hang out in our body to cause problems later, do we? No, we want to get rid of it. Right? You guys on board with that? You can nod your heads. All right. Here's one of the keys. I like to do the gotcha technique. I ask questions too. I ask about definitions for health. I do a little bit of multiple choice. If I ask you a question or if I ask you to agree with me, the answer is always true. Always true. Some people, not necessarily here at the Weiner Wellness Center, but some people in life, they like to stump their crowds. They like to stand there and give false information just for the sake of using big words, right? You guys have had that experience, I'm sure? We don't do that here. Everything, just agree, nod your head, say true, okay? So far, so good. All right, so we want to get rid of those toxins that we may have eaten before the roller coaster. They cause problems later, right? Might be a sign of good health to get rid of them. Our internal chemistry in action, right? Our external environment. Man, I used to think there were 2 seasons in southwestern Pennsylvania, football and construction. Now I see that they've blended into one, right? Traffic, it's not an easy thing to negotiate, correct? If you're anything like me, you may have had the experience of somebody doing what's known as cutting you off, right? You may have enjoyed that experience, right? You know what I'm talking about. Nod your heads, please. Thank you. Somebody cuts you off, so what? Live to drive another day. In fact, blow them a kiss. Wasn't personal, they're cutting everybody off, right? Probably, right? Yeah, that's just how they are. Good health. I'm interacting with my external environment. I'm not getting bent out of shape because somebody had to get where they were going faster than I had to get where I'm going, right? You guys on board with that? How many of you would agree with me that what you eat, what you put in your mouth, will influence your internal health? Yes? How many of you agree with me that sticking to a relatively healthy diet, taking good nutritional supplements, will have a profound effect on your ability to interact with, adapt to, and overcome your environment, at least internally? You guys on board with that? You guys maybe seen one of the movies that we show on Rolling Stream here. Maybe even in your own personal lives experience somebody who eats way, way too much junk food and they struggle to pay attention to what's going on. They might act with, I believe, what's known as misbehavior. You guys know what I'm talking about? So how many of you would agree with me that the food that you eat, the supplements that you should be taking, will help you recognize, adapt to, and even overcome your external environment as well? It's all very important stuff. So this is what's known as another shameless plug, okay? This is for nutritional frontiers in general. How many of you have a go-to dish? Every time you go to a restaurant, no matter which restaurant you go to, you order the same thing. You know what I'm talking? I see a few sheepish smiles, like I usually order I always order that, right? Whether we're at Applebee's or TGI Fridays or the grandest of all concourses, right? Right? We order the same thing wherever we go. And some places, it's just better than others. The fish is fresher. They put fewer hormones in the cows. The vegetables came from a better farm. The cook had a better clue what he or she was doing. It's just better at other places versus other places, right? You guys agree with that? All right, here it comes. Shameless plug for Nutritional Frontiers right now. Dr. Weiner and Joe Messina and Jamie Dorley, and I believe Mike Gallagher, and maybe even Dan McPherson sit on the board for Nutritional Frontiers, and they formulate the products. You can buy fish oil just about everywhere. My understanding is there are large chain corporation mega markets that will sell you spare tires for your car, a large screen TV, and fish oil, all under the same roof. All right? That's my understanding. I'm not 100% aware of this because I don't shop in such places. But you can get fish oil there. You can get fish oil formulated by Dr. Weiner and Joe Messina and Jamie Dorley and Mike Gallagher and Dan McPherson. And the advantage to a product that you get from Nutritional Frontiers is it's assembled, or the recipe is written by somebody who actually sees patients, who actually interacts with real live human beings and knows, well, most of my population is deficient vitamin D, D like David. Vitamin D is a fat-soluble vitamin. Fish oil is a fat. It will blend very nicely together. Let's put it together and call it one product. And at the risk of sounding like I'm using too many cliches, kill two birds with one stone. Make sense to you? So we've had this massive shameless plug for Nutritional Frontiers and the products in general. How many of you agree with me that your brain and its activity will influence your overall state of being, your health and wellness, internal environment and external environment? Your brain is involved in your ability to recognize, adapt to, interact with, and overcome your environments. How many of you believe me that your brain is involved in all that? Absolutely. That was emphatic. Thank you. That's like a double like. That's just not nodding your head. That's a real absolutely. Everybody else on board? So what kind of things can we do to stimulate our brains in an advantageous way to enjoy a better degree of health? Now I feel like I have your attention. You guys like the pink shirt story, but now you're sitting up straight. This is good. All right, good. I'm going to keep you in suspense. Let's review some vocabulary. In the past, I've introduced a few terms in a few of my workshops, and I think that they're really important that everybody know these words in the context of what we're doing here and in the larger context of life. Does anybody remember what the word nosocomial means? Nosocomial. Going once. Going twice. All right, I'm buying it. Where would one go to get a nosocomial infection? Yes. Ding, 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 ding. I saw your hand going up. You were going to say that, right? Good. Thank you. All right. The word iatrogenic. Who would cause one, not any of you, an iatrogenic injury? Going once. Iatrogenic. In the back.
Nurse or doctor.
Absolutely. You are playing right field from my perspective. My right fielder got that one in one. Your nurse or your doctor will cause you an iatrogenic injury. Proprioception. Anybody? Right fielder. Pass. Proprioception. Right fielder. Now, emphatic man. All right, proprioception, you're shortstop. I'm not going to call you emphatic man. I'm going to call you my shortstop. Okay?
That's good.
All right, good. Proprioception is the ability to recognize your environment and orient and position your body in such a way that you know where you are in space. If I decide, for some strange reason, to take a time out from this talk and walk through this front row and then around to go get myself some delicious vegan cuisine, I would have to navigate this difficult terrain without stepping on anybody's feet, right? Right? So if I'm stepping on anybody, I see you just tucked your feet a little bit tighter. I'm not going anywhere, don't worry. If I step on somebody's feet, that's an example of me doing a bad job localizing myself in space relative to everything that's around me, right? Yep. On the other hand, my right fielder is sitting in treacherous terrain. if she wants to get out and go get some delicious vegan cuisine, she's going to have to walk by the camera guy, who's doing a hell of a job, I might add, and duck herself down so she doesn't, well, maybe you want to appear on the video, I don't know, and duck down beneath the cameras and not trip on anything. If she can do that, that would be an example of good proprioception, the ability to find your position in space. You guys cool with that, or should we beat it up a little bit more? We're good? We're good? Nodding heads, excellent, excellent. Another cool word. Actually, a couple words all strung together. Brain-derived neurotropic factor. Well, we've talked about this a couple of times, and I know it's a lot of big words rolled into one. Brain-derived neurotropic factor. All right, let's break that one down. Everybody knows what the brain is, right? Well, everybody was at one point in life aware of what a brain was, right? Thanks for being here. I appreciate you. Neurotropic deals with, trophic means growth, and neuro involves neurology. So neurotrophic means what are we going to do to make our nervous systems, or part of our nervous systems, grow and expand, all right? And derived means to come from. So brain-derived neurotropic factor means that the brain has this quality about it where it produces a specific type of nutrient to allow itself to increase in capabilities. Pretty cool, huh? The brain actually takes good nutrition and oxygen, which we're going to talk about shortly, and it figures out a way to produce a chemical that expands its own capabilities. It sounds like one of those futuristic science movies where we create a cyborg, and the cyborg begins as our cuddly little house pet, but eventually decides to take over everything, and we're powerless to stop the cyborg. You guys on board with that? Right? We have one of those living right here in our melons. Right there in your coconut. You have a creature, your brain, that feeds itself and produces its own growth factor. That's awesome. That really is. You guys good with this so far? All right. So, anybody know what a trillion is? A lot. A lot. I see heads nodding. A trillion is a lot. It's a great big number. Would you agree with me that 3 trillion is an even bigger number? Now, my poor little warped mind, I might have a lot of brain-derived neurotropic factor going on. I might have at least adequate proprioception, but I can't comprehend what 3 trillion means. That's just, it's out of my price range. It's too big. Every second, your brains are processing 3 trillion bits of information. Every second. So what's a bit of information? The communication between your brain and your pancreas. How many of you right now are aware of your pancreatic enzymes and their relationship to the related hormones? And then producing the right types of hormones and the right types of enzymes and the right type of balance and all the insulin anybody could need, but not too much. And we have good sugar metabolism. Are you guys aware of that going on? You can feel it? Bingo. Not consciously. Good point. Excellent point. How many of you are aware that even as we sit here and speak, our fingernails are growing? Can you feel those fingernails growing? I can't either. More unconscious activity. How many of you are aware that underneath my jacket I'm wearing a pink shirt? Now we're in a different realm here. Now we're talking about conscious stuff, right? Okay? Of those 3 trillion bits of information that our brain is processing every single second, how many of those bits do you guys think are conscious? I'm sorry? None? Well, we have to at least have a few. It's more than none, but not much more than none.
50%.
I'm sorry?
15%.
All right, the answer here was 15%, which is a very low percentage, relatively speaking. But when you factor in 15% of 3 trillion, that should be like 4.5 billion, which is a very large number. And your percentage is not a bad guess, but you've grossly overestimated. Anybody else? Yes, right field.
Anything you can pick up with your senses, your hearing, sight, taste.
Yes, yes. The answer my right fielder said is anything that you can pick up with your senses. If you see it, it's conscious, right? If you hear it, it's conscious. If you smell it, if you touch it, if you taste it, it's all stuff that we're conscious of. That's a very good answer. But I'm looking for a specific number or even a ballpark number, and the answer is 50. 50 out of 3 trillion bits of information are conscious. Pain's conscious, isn't it? We are all, every last one of us, is acutely aware of whatever pain we're experiencing in the moment. Are we not? Yeah. And pain drives us to do some wacky, wacky things, does it not? I have heard tell of people who are in so much pain that they go to the hospital and subject themselves to the risk of a nosocomial infection, of an iatrogenic injury, right? That's a wacky thing. Now, I'm not standing here saying that we have absolutely no need whatsoever for hospitals. I'm not saying there's not a time and place. I'm saying that most of us grossly overestimate that time and place and go to the hospitals a little bit too often. And when I say us, I don't necessarily mean the people sitting in this room. I don't necessarily mean the people who are in the back room shopping for nutritional supplementation, the fine Nutritional Frontiers brand, formulated by just better chefs. I mean us human beings. I mean us people who live in the Western world. I mean us, you've heard talks the last couple days about our dependency on medication, the overusage of testing, the overusage of surgery, the unnecessary procedures, and it might not be you people, and I really have a deep appreciation for all of you that would come because this is natural health is a big passion of mine, and if you're here listening to what I have to say and listening to what the other speakers have to say, you're on my team, so I'm not blaming you for this. I'm blaming the people out there who aren't here listening. Pain makes us do some crazy things. Sometimes pain makes us do some smart things, like come to a wellness center to get better answers, right? But it's certainly a call to action, isn't it? It's absolutely a call to action. And pain represents conscious brain activity. Conscious brain activity is 3 trillionths of what's going on inside. Can we pause for a second and ponder that? 53 trillionths of what's going on is conscious and what we're aware of. Of those 50, pain might be dominating your experience at a moment in time, but it's not the only thing going on. So I think this is pretty cool. What if we could do something to influence bits of information 51 and up? All those unconscious bits of information, everything that's going on in your brain that you're not consciously aware of. What can we do to manipulate those 51 and up to get us to produce more brain-derived neurotrophic factor, to get us to enjoy better proprioception, to get us to enjoy a more suppressed pain life experience? You guys think that sounds like a good idea? All right. So the first thing that comes to mind that we have to do is we have to move. We have to get our body. Somebody looked at me with these great big wide eyes and said, we have to move. Let's, in fact, exit Pittsburgh. We're all going to Philadelphia. No, we haven't. You don't like Philly, huh? All right. Cleveland. All right, so what we have to do is move our bodies. Oh, I got another wide-eyed look from my right fielder. I lived in Kansas City for 4 years. I'm out of suggestions. All right, what we have to do is move our bodies around. We got to do things like exercise, and we got to do things like chiropractic adjustments, which is a form of creating movement. All right. Now this fellow, Dr. Roger Sperry, in 1981, won a Nobel Prize in medicine, which I think is a pretty nice certificate to hang on the refrigerator. A Nobel Prize. That's not bad. Not bad at all. Now, what he did was, in his studies, he learned about specific parts of the brain controlling specific activities. So my big hobby and my favorite thing to do is X. I like to just sit on the floor and X every moment I get. Okay? My right fielder likes to Y. She's on the other side of the room, she's just Ying. Whatever it is that Y is, that's what she's doing, and she's doing it well. Okay? Now I have this part of my brain that's dominating my X activity, and she has this part of her brain that's dominating her Y activity and allowing all this to happen, right? And she says, hey, Orbach, you're playing over there by yourself. I'm playing over here by myself. Why don't you come play Y with me for a little while? And I'm shy. I'm not really outgoing, and I don't really play nice with others anyway. So I'm staying here playing my X. So my right fielder, being the sympathetic, overly social, friendly person that she is, says, all right, I'll come play X with you. So now the same part of my brain that I was using to do X is still active. My right fielder's Y part of her brain just kind of calmed down. It didn't really go to sleep, but it started just taking a nap, just a baseline nap. And the X part of her brain turned itself on and started performing so she could be involved in my X activity. The same parts of our brains to do the same thing. Well localization of specific tasks. Okay? If we took a brain scan of every single one of us, all right, and we get a baseline idea of what our brains are doing, and then all of us are put into the room that has the smell of cinnamon. Strong cinnamon odor. Does everybody like cinnamon? At least a little bit, at least tolerable. I gave this example with peppermint once, and somebody said, I don't like peppermint. I said, okay. So, all right, no problem. So we all have a baseline scan of what our neurological brain activity looks like, and then we go into this room individually to take a deep breath of cinnamon. The same parts of all of our brains, identical, are going to flash with increased activity because the parts of our brain that allow us to smell cinnamon are identical one to the next in the context of Roger Sperry's experimentation and learning. Does it make sense to you guys? I will beat this up so many times if I have to make sure you all get it. So if you want me, if you feel comfortable with this explanation, nod your heads. If you feel like, all right, everybody stop. If you feel like you want to hear another example or a more clear or yet even more explanation of this, nod your head. All right, good. We can move on then. Now, what Roger Sperry learned was the most amount of neurological output was geared toward proprioception, the ability to orient yourselves in space, the ability to recognize your environment and position your body accordingly. Now, the thing about proprioception is there's such thing as conscious proprioception that we're aware of. If I decide to take that time out for a little bit of delicious vegan cuisine and walk along this way, you're perfectly safe. You tuck your feet in. You, not so much. I might step on your feet. No, I'm staying put. Relax. Okay? So that's conscious. Now, I have a level of unconscious proprioception as well. What if I shut my eyes and now I'm sensory deprived? I didn't topple over, did I? No, not at all. So we're going to have aware and unaware proprioception, and we want to do exercises to stimulate the unaware component and turn it into aware. Guys okay with that? We're taking bits of 51 and up and recruiting them to join our activity that we're going to become conscious of, and we're going to get the most aspects of our brain to fire away, and that's a big effort to suppress pain. The better your proprioception is, the more you have the ability to suppress pain without medication, without this, without that, without drugs and surgery. Better balanced people experience less pain. And you can see that in yoga class. You can see that in Pilates. You can see that in martial arts. You can see that in people who go for a walk every day, who walk on uneven terrain. So we want to do a couple of things right now. First of all, I want everybody to sit up straight and tall. I want you to exercise the best chiropractic posture that you possibly can. And I want to remind you all, this is also a chiropractic clinic. We take care of people who have headaches, back pain, foot pain, what have you, and numb hands, and a host of other things. And so I want each and every single one of you, and I recognize some of you as being my patients past and present, and some of you, well, maybe we'll meet, maybe not, we'll see. But impress me with your posture. Every single physiological experience that you might have, our ability to digest our food, whether we're conscious of it or not, our ability to hang out and have this conversation, whether we're conscious of it or not, our ability to suppress our pain, our ability to interact with, adapt to, overcome our environments, internally or not, it's all oxygen dependent. We have to get enough oxygen into our bodies to keep ourselves going. So what I want everybody to do is take a deep breath in through your nose, and while you're doing that, I want you to maintain this upright posture, and I don't want you to shrug your shoulders. I don't want to see this. I want to see you inhaling through your nose and pushing your torsos out. And if you're sitting in the back, even further beyond my right fielder, I think my left fielders are deeper than my right fielders, if you can fill yourself up with so much oxygen that your torso comes all the way out and stretches and knocks me backwards, I will be impressed. All right, everybody, in through your nose, expanding our chest. Hold it for 1,001, 1,002, and now we're going to blow it out through our mouths. And our torsos are going to sink in as we blow out. Let's do that again. Air in through our noses, and we're getting big. And we're going to blow out through our mouths. Torso's becoming small. What do you guys say to one more? Let's do it. Big breath in through your nose. And sink your abdomen in and blow out through your mouths. All right. 3 big deep breaths in a row. What are you guys feeling? Anybody lightheaded? Excellent. Excellent. Anybody feel like that was well and good, but if we had 10 deep breaths, I can see where I'd become lightheaded? All right, you guys might be better at this than I am, because my threshold is about 7 or 8 before I become lightheaded. And that's why I take about 3 to 5 deep breaths in a row like this in between every single patient. It's part of my ritual. It's part of me getting centered. It's part of me getting myself ready for the next person. It's part of my exercise routine. How many of you have a dog or a cat? How many of you have observed a dog or a cat? Okay. You have to at some point. So I'm sitting on the couch watching TV. The dog is crumpled up in a little fetal position ball at my feet, chilling out, relaxing. He's fallen asleep. He was giving me that, aren't you going to pick me up, put me on your lap, and scratch me look? I said, no, buddy, I'm just kind of watching TV, chilling out myself. Why don't you scratch me for a change? He looks at me and says, you are crazier than I thought. And he just curls up and goes to sleep, right? The dog wakes up startled. What's he do? He looks around, arches his back, stretches his front legs, stretches his hind legs, arches his back again, and gets on with his day, right? You guys have all seen this, correct? At least once. What's the cat do? Same thing. Same thing, basically. The cat actually has this weird thing where it telescopes its body up, and the cat's like this big, but it looks like it's 8 feet tall when it stretches itself. right? How long does it take that dog or that cat to do that stretching exercise? A few seconds? A few seconds? That's right, just a few seconds. How many times a day do you think the little dog or the cat does that routine? Exactly. I don't know. I never spent all day counting, but I would guess at least 20. What do you think? About that. About 20 times a day, the pet spends a few seconds stretching, right? Let's all follow that model and take a few deep breaths in a row, just a few seconds worth of deep breathing, multiple times per day. What do you guys think of that? Did I hear somebody say in the back say it sounds good? Was that wishful thinking? All right, so let's do that one more time. Everybody breathe in through your noses, and as you're inhaling, think of your torso as a balloon, and we're blowing it up this way. Go ahead, big breath in through our noses. 1,001.5, and blow out through your mouths. Let's do another one. Big deep breath in through your nose. And out. One more time. In through your nose. And out through your mouths. You guys feeling good? Like you might float away? Like big balloon, helium? I got to pull you down off the ceiling, anybody? No, okay, we're good. I'm sorry? No, you're okay. Not yet, okay. So let's rehash the significance of this. Anything that we're going to do, whether it's conscious or not, whether it's part of bit of information 1 to 50 that we're aware of through our senses, whether it's bit of information 51 and up, which fortunately for us is happening and we take for granted and that's the end of it, oxygen dependent. Let's now do something to stimulate some better proprioception, the ability to orient our bodies in space. If I could humbly request that everybody just stand up. And what I would like everybody to do is we're going to bring our feet as close together as we possibly can such that they do not touch. If your feet are touching each other, we are recruiting other senses and a better part of the sense of feel to recruit more, to basically make it easier. So we're going to make it harder on ourselves, and our feet do not touch. And what I want everybody to do is lean forward and put their weight on their toes and lean as far forward, weight on their toes as possible so that their heels remain in contact with the ground. Now, we're going to lean backwards. We're going to put our weight on our heels, and our toes are not coming up off the ground, but they're pretty much weightless. Let's go ahead and lean forward one more time onto our toes. And now let's rock backwards onto our heels. All right, now we're going to stand, weight evenly distributed on all points of our feet, standing up straight and tall, and shut your eyes. Beautiful. Everybody open your eyes and have a seat, please. Now, I don't want to risk embarrassing anybody, so this is a question that you're going to answer for yourself and not out loud. When you were rocking forwards and backwards, did you feel for a split second or a fraction of a second or a moment in time that you were just off balance and you had to struggle to catch yourself so you didn't fall? Now, I was watching, and I'm not mentioning any names, and I don't want anybody else to mention names, but I saw a few hands reaching for the chairs in front of them or a hand going to their hips. And that's exactly what I wanted to see. Exactly. Because it was a challenge for those people, and exercises are meant to be challenging. How many of you felt just a little bit off balance with your eyes shut? We were just standing there, feet grounded, feet close together, but well balanced, weight evenly distributed between all points of feet such that you determined to be comfortable. All you did was shut your eyes. I saw a few people, they looked like they were at the club on Latin dance night, trying to focus or ready themselves or get back upright. These look very simple. How hard can it be to rock back and forth from your toes to your heels? How hard can it be to stand in straight upright posture with your eyes shut? Well, I'm here to tell you it's pretty challenging. It's very challenging. These are proprioceptive exercises. Okay? Now, your brain remodels to pain. When one is in pain, when one is getting that warning sign that says go take action, known as pain, which is conscious, the motor cortex, that's the front part of your brain that helps you make action and movement plans, remodels. It forms itself into an adaptation to that pain. That's not good. That's not good at all. Maybe, just maybe, you or somebody you know might have had an experience where they turned an ankle. They rolled their ankle so severely that it was swollen, it swelled up, and they had to walk with crutches and ice it. Somebody may have done this. I know I have. And what happens as a result? Well, hopefully you do the right chiropractic and exercise and muscle therapy and icing and take the X-Flame anti-inflammatory and the Ligaplex and the list goes on. We got to the point where that ankle is healed. You've thrown away the crutches. But an odd thing happens. That patient still limps. They still have a change in the way they hold their feet on the ground and hold their weight on their feet. They walk gingerly. Why? It healed. Why are we doing this? Well, the motor cortex is remodeled. And the best way to bring that motor cortex, that part of your brain, back to normal, back to where we want it to be, back to an advantageous position, is through movement, through exercise, through appropriate targeted exercises. So how many of you agree with me that what we've just done is a proprioceptive exercise? Well, it's not a trick question. Nod your heads. Nod your heads. I said so. Simon says. All right. How many of you would agree with me that not only was that a proprioceptive exercise, but it was also a good way to get our ligaments and tendons and connective tissue around the ankle joint to stimulate, to move a little bit, to stretch as much as they possibly can, maybe even to strengthen. How many of you would agree with that? Economy of effort. That should be a new vocabulary word next time, don't you think? Economy of effort. What does that mean? Anybody? To multitask. Economy of effort, a fancy way of saying multitasking. I like these low-tech exercises that allow us to do a lot of things at once. When we take those deep breaths, when we're getting all that air in through our noses, holding it in our expanded rib cage for just a brief moment in time, blowing it out through our mouths, how many of you would agree with me that the musculature of our upper backs, the front of our necks, are moving and stretching and maybe even strengthening in a pattern that we want it to? I'm sure that at least one of you that I'm talking to has had the experience where they're sitting on the couch watching TV with their heads and necks craned forward, or maybe while they're driving, or maybe while we're working on the computer, or maybe while we're eating. And just maybe that head coming forward a little bit too much caused a sprain, strain injury of the musculature of the upper back and the bottom of the neck. And you get these knots between your shoulder blades. Some people say they hurt. Those little tight spots right about here. I've heard tell, and I believe that it could be true that they're not comfortable, those little shoulder blade pesky knot things. And they lead you to do crazy, crazy things. Maybe not you guys personally, but they lead people to do crazy things like see pain management doctors for injections. Oh my God, that hurts just to say that out loud. Because I know for gospel truth that I have had patients in the past who have complained about tightness in their upper backs and their necks and the muscles between their shoulder blades. I know this for gospel truth that they've had this. Maybe taking those deep breaths in good chiropractic posture will help to eliminate some of that. Maybe spending those 30 seconds at a time rocking back and forth from heel to toe, standing upright and still with your eyes shut. Maybe that'll strengthen your ankles a little tiny bit. So you go for a walk, and where you once might have rolled your ankle and had that big explosive inflammatory blowout that led to crutches, it turns into a, hardly felt a thing. Maybe, just maybe, doing that exercise will cause the 26 movable bones in each foot to move through their proper patterns, creating greater dexterity and eliminating foot pain, eliminating some foot pain. You guys on board with me? Am I going to have a hard time talking you all into doing those two exercises for a few seconds at a time, multiple times throughout the day? What do I got to do to sell you this car? You guys into this? Excellent. Now here's something that I think is really, really cool. And this is the last point I'm going to make because I want to have a little bit of time for questions and answers before Dr. Weiner takes over. Brain-derived neurotropic factor. We talked about that as a vocabulary word towards the beginning, right? We talked about how the brain has the ability to produce its own chemicals that lead it to expand in its capabilities, right? Right? Well, I don't remember if this is 2011 or 2012, please forgive me, but either way, that's fairly recent when we talk about the context of scientific research. It turns out that muscles produce brain-derived neurotropic factor as well. So if we are getting our bodies in motion, and by in motion, I mean doing the exercises that we talked about, doing literally dozens of other choices of different types of exercises that you can do, getting chiropractic adjustments, getting muscle therapy to lengthen and stretch muscles, by doing any of those things, right? We are, in essence, going to produce the chemical tools for our brains to expand and become more powerful and have more capabilities. You guys cool with all that? Very good. So what I want to do first and foremost is thank you very much for your kind attention. I don't get a lot of opportunities to ramble like this, and I'm appreciative of the chance. And I'm appreciative that all of you would come to Wellness Week and indulge one of my great passions of natural health. And just by being here, I'm inclined to like you. Dr. Weiner's scheduled for a speak fairly soon, so hold on to your seats. But before you do, before I exit stage, I guess this would be left, my left, I'd like to entertain any questions that you might have. Wow, this never happens. I must have been more clear than usual. Yes, please.
I have rheumatoid arthritis, and I was wanting to know what you recommend for that.
All right, the question was what I recommend for rheumatoid arthritis. Well, we have to take the approach that rheumatoid arthritis is a systemic problem with localized problems in the joints that you might feel, right?
Right.
So we need to do things to clean out the entire system, and we're going to start with the digestive tract. So diet is a big factor. There's certainly some foods and some chemicals that we voluntarily expose ourselves that create more inflammation than others. Very briefly, sugars, gluten, animal proteins, soda pop, that's a big culprit. These are inflammatory components of our diet. And I'm grossly summarizing. I mean, if you want to talk to one of the nutrition people working in the back, there's all sorts of literature that will go into much greater detail floating around the office. So we want to first of all start with a diet that will not trigger more inflammation. Something else that we want to do is we want to make sure that our immune systems are coached in such a way that the immune system won't start overproducing inflammation. I like the Immunomax. I like the X-Flame, which will help to suppress inflammation. I like probiotics, GI-friendly bacteria, which will help to protect the immune system, right? And then we have to do something to make the joints where the manifestations are occurring, we have to protect them, or we have to allow for the joints to move freer and easily. I like the hyaluronic, the HA+, very good choice for that. We have to do something to get tight muscles to relax. Minerals, multi-mineral in general, magnesium in specific. And we have to do hands-on treatment to reinforce the proper movement patterns of your body, chiropractic, muscle therapy to a greater extent. And we'll probably figure out areas where you specifically and you personally have deficiencies, and we'll figure out low tech, meaning no equipment needed, just like we did with the breathing, just like we did with the balance. We're going to figure out low tech exercises that are specific to your needs, not just general all-purpose. So that's the very short answer for RA. The longer answer, I would really encourage you to see one of the nutritionists here for a formal appointment, maybe Dr. Honigman or Jamie Dorley, and really spend a good 40-45 minutes talking about your own personal experience, and they'll help you take this list that I've made and whittle it down to what you would need rather than just a general overview. But I want to assure you that we see quite a few patients who have similar challenges, and all of it is patient compliance, that you hold up your end of the bargain, and we've been able to help everybody to an extent, right? And then we have these patients who, they don't hold up their end of the bargain. They don't want to come for their appointments. They take half the supplements that we recommend. They don't do their exercises, and then they want to blame us for things not going their way. If I could, you seem like a nice lady. If I could wave my magic wand and make this all go away, I would. But it's a team effort. Okay?
Yep, thank you.
Sure. Anybody else?
Yeah.
Sir.
You gave us the example of one exercise. Do you have any literature of these type of exercises equivalent to that one?
You probably noticed in previous presentations that these guys use PowerPoint and have handouts. I'm on the Dewey Decimal System. I'm using index cards that I don't even look at. If you, I don't have. Yeah. No, I'm on two. I'm sorry. I don't have specific literature on the exercises, but most of the exercises that I teach, at least the low-tech ones, they either come from yoga or Tai Chi, and many of which are exercises that I don't want to say that I've invented them myself, but I've adapted them. Like if you were 19 years old playing college football and weighed 252 pounds, and you said to me, I'm just not going to get playing time unless I'm up to 260. And somebody else says to me, I think I can stop walking with this walker, but I need some help. I know I have the potential to do it, but we got to do some work here. We're going to use the same principles for person A and person B, but we're going to have a different intensity of the type of exercises that we do. So I don't really have any specific literature on specific exercises, and I'm just going on general principles. But if you're really curious, if it really something you're into, I give you the contact information for my personal trainer and for a number of people that I work out and where I work out, and you come and join us. We'll do it. Anybody else? All right. I guess this concludes our time together, and I'm glad to see that so many of you joined me, because in the past I would have a small crowd starting at 11, and at about 11:46, I would have a crowd like this, and at 12 o'clock, Dr. Weiner would take over. So for being here from the beginning, I want to thank you for stroking my ego.
Thank you.